Alliance Healthcare Services, not only for sponsoring our event, but for all you do for the population that we serve. All right, we are ready for our second presenter. And our second presenter is a graduate of the University of Memphis, where he studied psychology, counseling, and philosophy. He's currently completing his master's in social work at the University of Tennessee while concurrently pursuing a specialization in trauma. Chris has over 12 years experience working in the behavioral health field and currently serves as a program manager for CAP Incorporated, providing administrative oversight for a medication-assisted treatment program. Priding himself on being a non-traditional professional, he strives to confront existing flaws in the system, expand upon the inclusiveness of recovery, and develop more effective systems of care. And I can tell you that that bio does not even do him justice. Just from being able to speak from experience, I can say that Chris is not only a staple in our community, he is a pillar. He is somebody who I can call anytime, day or night, and he gets the job done. So I'm honored to introduce you all to Christopher Moore.
Morning, everybody. Thank you so much, Austin, for the kind words. Also, before we get started, want to certainly thank the coalition and all conference committee members for working so hard to ensure that despite the pandemic, we have these needed platforms for continued learning. Equally as important is thanking all participants for making time to attend, ensuring that this field of helping continues to grow in its understanding and effectiveness. And I'm going to share my screen. Let's go here. And we will, before we get started, I'll tell you, when last week I was working with a young man who is from somewhere up in rural Tennessee, and we were just talking about his journey of how he got here. And as we were speaking, he referenced that he came to Shelby County in hopes of overcoming some of his problems. He thought, hey, a change in scenery would certainly unlock his hopes for a different life. And so the young man began to describe what a lot of his direct experiences had been here in Shelby County. And then he refers to a place that I've always called home as Gotham City with no Batman. Now, being the proud native of Shelby County I love my city with all my might. I really quickly began to defend, this place I call home. And I had that moment of clarity that really he's not that wrong. And so it was a funny moment we shared together. And, thank you, Mr. Jackson, for your presentation. Mr. Jackson certainly illustrated a lot of the gains, successes, and things that are going on across the state and at the regional level. I'll tell you, here locally in Shelby County, while we've made tremendous progress, and certainly not to be a pessimist, I think that if you were to ask any of us involved on the front lines, what you would hear from most of us is that if we were looking at this epidemic of substance abuse across the board as a boxing match, most of us would say, yeah, we've won a few rounds, but we're nowhere near winning the fight. And so it matters that we continue, exploring various avenues to create the kind of needed difference that exists in our community and as well as across the country. So here in Shelby County, during the week of March 14th and the 20th, there were 44 opioid-related emergency room visits, 56 suspected drug overdoses. Year-to-date, suspected drug overdose deaths are around 105. That has likely changed since March 27th. We have the Shelby County Health Department to thank. They have a data feed in which they're constantly tracking these numbers, looking at trends. We also know that, as of recent, there's been a significant resurgence of methamphetamine use, benzodiazepines. These are just trends that we're starting to see. And if you study the history of drug use trends, when some go down, others generally go up. And so We also know that, with fentanyl on the scene, that there's just unprecedented risk for overdose, death, consequences. We've, as of recent, had some clients that have actually, during their overdose, blood circulation has been cut off to certain limbs. And so we've had a few clients who have lost toes, limbs. It's really something else to see. COVID pandemic has certainly made problems worse. It's changed everyday life for everyone, but also in the treatment industry, success rates have drastically, declined. It's just real ramifications. And so, as we're navigating all these things, what we also know about Shelby County and even on the state level is that it is estimated that over 367,000 people in Tennessee struggle with substance use disorder. Far-reaching impact of drug use is well established, how it affects family, relationships, employment, finances, health, and so on. Equally important, in 2019, over 264,000 people were estimated to experience some sort of serious mental health issue. And over 234,000 encountered serious thoughts of suicide. There's some other important things to think about when we're thinking about the problem of drugs. The TBI estimates that 80% of current crimes are estimated to possess some drug-related nexus. TBI also claims that there are at minimum 800 existing meth labs in the state of Tennessee at any given time. And again, related to the pandemic that we've been in, unemployment, poverty, homelessness rates, all of these are just increasing at a rapid rate. An interesting thing about Memphis, we were top 3 in the country for most eviction filings during COVID-19. And so, when we think about where we are on the scene here on the front lines, like we know that suffering is widespread, challenge, struggle, stress. There's just a lot going on here on the scene. And while we've certainly made a lot of progress over the years in trying to respond to this problem of drugs, again, we're just not where we need to be. And there's always, to be mindful of the hope on the horizon. There's several treatment programs in Shelby County for substance abuse and mental health. Last few years, there's just really been a strong push by various agencies to just create a special collaboration. Never before have all of these existing agencies been in on the level of communication that's now occurring. And so, expanded resources. It's never been easier to get in treatment, detox, inpatient, outpatient. Again, the state has done a wonderful job providing us needed resources, and while you can never have enough to take on this fight head on, we certainly are fortunate to have what we do to try to create the difference we know that's needed. So when you think about all of the existing resources, Mr. Jackson also referenced a lot of different prevention efforts and programs that are going on to try to help people abusing substances. Some questions arise. Why don't substance users stop? Why do so many refuse help? Why is the problem of drugs seemingly getting worse? Why are relapse rates so high? And why are treatment outcomes so poor? So later today, we'll hear Josh talk about some important information related to the impacts of drugs on the brain. But one thing is you listen to him educate us and provide those important insights. We need to know that when you're thinking about people and the problems that they're experiencing, you cannot reduce people to neurochemistry. You'll never fully comprehend the entire context of what's going on with someone simply through their neurochemistry and biological makeup. When we're thinking about solving this problem of drugs, we need to think about all that involves. And when you think about the problem of drugs, in a lot of ways, it's not about drugs, and solving it really has little to do with substance users, but in fact, everything to do with our society, our existing systems, and us as people certain to encounter individuals struggling with issues they don't fully understand, and more importantly, really aren't to blame for creating. So those perplexing questions, there are no concrete answers. There is no black and white solution. But we need to think about how throughout the history of treating substance abuse and mental health, People have been viewed through a pathological lens, believing something is wrong with them, labeling them as problematic or difficult, and to blame for the wealth of problems that surround their life. Stigma is another really serious issue that, compromises our ability to move people forward in their life. There's self-stigma, public stigma, institutional stigma. The areas of demonization, criminalization, and medicalization are still alive and well. Reductionist perspectives can be dangerous and certainly inhibit progress. When we oversimplify what a person we're trying to help is experiencing, what all they've been through throughout their life to reach this point where they find themselves in, it's dangerous. There are obviously, existing gaps in knowledge, undeveloped professionals, archaic treatment models, challenge of current data. Mr. Jackson referenced a lot of current data, and if you track data, you'll always be able to easily determine we always play from behind in this field of helping others. We are always 2 to 3 steps behind, and that's why it's so important we continue striving to pursue education and make sure that we're doing all that we can to stay in the know. Another thing, working with substance abusers, we need to think about presenting problems are really more like results and outcomes. Very often we focus on eliminating that problematic drug use, when the reality is, for many substance abusers, when you interrupt that drug use, the struggle doesn't end, it actually intensifies. So, always be mindful that, what we observe on the surface is really more of a result from private internal processes, and serves as an indication for us to do a little deeper exploring of what's really going on here. We heard Dr. Bilbrook at Alliance talk about underlying causes and conditions. We also know that the problem of drugs is complex in nature. It involves a lot of intersectional issues. When we think of intersectionality, we want to think about the overlapping social identity that all of us have. We think about race, age, gender, class, orientation. When we explore these various categories in which identity formation occurs, we know there are specific challenges to each of those categories, systems of oppression, discrimination, domination. All of these things matter and have played a part in shaping and producing that person that stands before you that you're trying to help. So when we're thinking about the who we're working with and the substance user, throughout my career, I've always really tried to think about the 3 aspects of that person in front of me, and that's their thinking, their feeling, and behavior. Encounter challenges and characteristics. You think about the pleasure principle, immediate gratification of wants and urges. Escapism, that's a really important thing to remember. Avoidance of discomfort and pain. Impulsivity, compulsion, cognitive distortions, alienation, isolation. I mean, here's a list of some of the just common characteristics that we encounter when working with substance abusers. The really important thing to think about, though, and this ties into, overcoming this problem of drugs, isn't necessarily about drugs. Which comes first? The substance abuse and the problem of drugs produce these in the individual, or is it that this is actually going on and this is what produces the drug use in that individual? I want to talk about a few studies that I think really help us understand there's a lot more going on than mere drug use. There was a study back in the 70s by Bruce Alexander, Rat Park, somewhat of a controversial study. Psychologists tested the hypothesis that drugs do not necessarily cause addiction, but rather the existing conditions in one's life. Lab rats were isolated in cages and were provided 2 sources of liquid, water versus morphine. Dependence on morphine was extremely high. Consumption rates in morphine implied it was actually preferred over food and water. Many of the test subjects ended up killing themselves through their consumption of morphine. So researchers actually created another study, and what they did there was really manipulate environmental factors to see did that make a difference. Other lab rats were provided the same options of water and morphine, but it's in a significantly improved environment that involved entertainment, socialization, open space. What these researchers were able to determine is that the rat part morphine actually remained largely untouched, while the caged rats in desolate conditions sought drug-induced haze. Another trend that they noticed is that normal social life not only was sought by one control group, but even for the drug-dependent rats, it was enough to motivate them to endure withdrawal. There was another important study back in the 1977, our Vietnam veterans. It was a detailed study of a group of hundreds of heroin-addicted people. Many of our veterans returned home addicted and heroin dependent. 90% of those veterans ceased drug use upon returning to the States. Now, the immediate thought may be, oh, well, they didn't have accessibility. It wasn't available here in the States as it was over in Vietnam. It's actually not true. 85% reported that opioids were just as readily available at home here in the States as they were, across the seas. And so, while half of those individuals did eventually try drugs again, under 1/3 of them would ever meet the criteria for a diagnosable substance use disorder. And the only real difference when you pick apart this study is a radically transformed environment. And so we see there through some of those implications, it's really easy to blame drugs. But what we know is we cannot understand substance abuse or abuse without exploring important factors related to our surroundings. Environment influences and motivates behavior. Many of our substance users, what they're really addicted to is not so much the drug as it is the altered state. Like, drug use serves a purpose for every user. All of us know what drugs cause and the havoc it wreaks in the lives of substance abusers. But what we also need to be thinking about is exploring along the lines of, what does it do for that user? What is it relieving? What is it alleviating for that individual? What we also learned through some of those environmental lessons from Rat Park and Miss Robbins' work is that symptoms related to drug use fuel destructive drug use patterns. And in a lot of ways, addiction is a product of life circumstances. Another important study when you're trying to truly, develop an understanding of the individual in front of you, there was a study called the Roughnecks and the Saints. This study was about 12 high school boys, and 6 of the boys were categorized as the Saints. The others were categorized as the Roughnecks. Now, 6 of the boys were from middle-class families, endless resources, and for the most part were expected to do well in life. The other 6 boys, not so much. Were from lower-class families, poorer neighborhoods, limited resources, and were generally expected to fail. One really interesting thing about this study is that both boys exhibited the exact types of activities and behaviors: skipping school, drug use, fighting, criminal behavior, all of these various things that were displayed. Both groups did them at the same frequency. However, there were really radical contrasts between the societal responses these boys encountered. Saints' behavior was generally excused and shielded from consequences because of that fundamental idea that these were just really good boys, and they were not deviated because of what they were doing. The Roughnecks, however, were scolded, faced reoccurring consequences, as they were typically viewed as bad, delinquent, and deviant. So the outcome of this study, and why I think this is really important when we're looking at what else is going on besides the actual drug use, is that when they track the outcome of these 12 boys, the Saints group all fared better off in life. 5 out of the 6 graduated college and were established in professional careers. Only 2 of the Roughnecks went to college on an athletic scholarship and later became high school coaches. The other 2 never graduated grade school, and 2 of the other ones ended up in prison. So some of the implications there are just issues such as class, race, gender, orientation, and culture matter. Our interactions with the world, especially in those early developmental years, certainly become the foundation of our belief and identity formation. I think it's not hard to sell the idea that there's just real power in the messages people hear about themselves. Labels are extremely influential. and become internalized aspects of one's identity. We know that happens early on, but even as substance abusers are running through these treatment systems, and very often, sometimes the most difficult of clients that we're trying to help, this lesson still applies, right? It's not uncommon for clients and substance abusers trying to make changes to be labeled as, deviant, uncommitted, problematic, extremely difficult. And so we need to be mindful of how a lot of times when we're interacting with individuals and trying to make a difference, there's real danger that we're reinforcing and perpetuating the same kind of stuff that's actually led to them being where they are. Life scripts are constructed unconsciously in response to incoming messages people receive about themselves. Think about all the various platforms that we receive messages about ourselves: parents, family, school, peers. The list goes on and on. When we think about and study life scripts, we know that very often people participate in a life script completely unaware of what's going on. Experience, societal response, and assigned labels certainly can be a serious detriment to one's life trajectory and often become self-fulfilling prophecies. The last study I want to reference is one that's much more commonly known about now, but I will tell you, I'm also a regional trainer for the state of Tennessee in the Certified Peer Recovery Specialist movement. And I can tell you, very often in these trainings, we have established professionals in the treatment industry that pursue that certification. And so we talk about trauma in the ACEs study in depth in this CPRS training. And I cannot tell you how often I hear professionals in the substance abuse community that have worked there for years, that when you ask about the ACEs study, they do not have direct knowledge of it. And it's such a tragedy, given the implications that result from this important study. So the adverse childhood study actually began as a suspicion trying to account for problematic and regressive behaviors in an obesity clinic, eventually led to a large study of over 17,000 people. At the obesity clinic, what was discovered unintentionally was that there was a large percentage of clients having experienced childhood sexual abuse. So that led to a larger study, and participants were asked about various types of adverse childhood experiences: physical, sexual, emotional abuse, exposure to domestic violence, substance abuse, mental illness in the household, parental separation, divorce. There's just a lot of I think there were 10 things that were asked about. And one thing you need to know about the ACEs study, though, and it's very important, is that the ACEs questionnaire still to this day does not completely account for all situations that can create toxic stress. It fails to explore humiliation, shame. At one time, it didn't explore bullying. I think now they've made that addition. But what was found is that nearly 64% of adults have experienced some type of adverse childhood experience. And so there's a breakdown there. What we know is that as adverse childhood experiences increase, so do significant risk for all sort of behavioral and health consequences. It's currently estimated that in the state of Tennessee that there are at least 59 children who have experienced adverse childhood. And so when you're thinking about, where we are and what we're up against, again, we're not winning this fight, and we know there's more trouble coming, and there are going to be a lot of people in need of help down the road. Some of the studies or the findings from the ACEs study, startling discoveries were made to the impact of toxic stress and traumatic experience. The longstanding debate of nature versus nurture was kind of dumped on its head. For a long time, substance abuse was thought to be strictly genetic. There was the idea of the addictive personality. So the ACEs study really helped enhance our understanding and created that connection. We know that it's not about who's right, nature or nurture anymore. It's this ongoing interplay between both. Environment and lived experience have a direct impact on our neurobiological development. It was deemed that hardship, adversity, and trauma disrupt brain development, leading to functional differences in learning, behavior, and overall health. If you have some time, research epigenetics. Extremely fascinating research. It's a study of how external factors directly alter our gene expression. It really harnesses and focuses in on the ongoing interplay between biochemistry and environment. As of recent, there was a discovery of just profound significance, and now we're beginning to understand that epigenetic changes can be passed on from one generation to another. This means that any of us or those that we serve could be experiencing health consequences related to the past experiences of their parents or grandparents. So when we're thinking about those three studies, and one thing that's just extremely important and critical to keep in front of you at all times, and in social work, we talk about that person and environment perspective. We need to explore what has surrounded this individual throughout the course of their life, all the various systems that have existed, and how much of those account for this conditioned result that this substance user in front of us appears to be. We think about demographics, class, race, sex, culture, orientation, education. Other systems are the family, school, neighborhood, peer group. We need to think about relationships, parents, siblings, family, teachers, friends, so on. And then the societal norms, the rules, expectations, the musts and shoulds of their environment as they were growing up, and how those impacted that individual's, psyche, development of their identity. So none of those studies necessarily are comprehensive and fully explain the problem of drugs, but what it is extremely important to do is incorporate those findings into our efforts of trying to make a difference. When we track the history of treatment and trying to help others, we know that thankfully we are evolving in our understanding. However, sometimes it's just a little slower than it needs to be, and there are real ramifications. As a person in long-term recovery, I can tell you that there's a saying in the rooms of recovery that our problems of our own making, our troubles of our own doing, and frankly, we actually know that's not true. When you study research around the prevalence of trauma, when we look at some of these other studies of how early life experiences condition, impact, shape, and influence what takes place later in a person's life, it's really easy to pick apart and understand that actually a lot of the things going on with the individual we're trying to help, it's not their fault. It's not really their own making, right? And so when it comes to the issue of compassion, patience, and working with someone, it's really not hard to manifest if you have a more comprehensive understanding and complete picture of where this person has been, what they've been through, and all these various things that have contributed significantly to what's going on with them. Again, it's about so much more than the actual drug use itself. So when we're thinking about substance users, what we want to talk about is the cycle of suffering. And so if you look at the data, let's just think about Rat Park and the Roughnecks and the Saints, and then the ACEs study. So we know here that negative experiences generally begin to impact that individual in early on developmental stages of their life. Very often we think, well, trauma isn't always the cause of substance abuse. But if you spend enough time working with substance abusers, you generally can always pinpoint some painful experiences throughout the earliest stages of their life. And it's not real hard to start connecting the dots. Now, a lot of times the substance abuser is not going to talk about that with you. It takes time to build trust, connection, but it's always there. And I think that's what we've always got to be mindful of. There's so much more going on with this individual than what we see on the surface. We now know, the research establishes very clearly that those negative experiences early on in life begin to directly impact our thinking, our interpretations, beliefs, attitudes, outlooks. Our early on experiences in life become the foundation for our belief and identity formation. We now know, again, research establishes that link between the feeling states and thinking states of individuals. So we know that once those negative effects start impacting our thinking states, belief states, we know that directly impacts our feeling states. And you know, again, most of you know this in this conference, that you know, behavior is the result of what's going on internally with an individual. So in this cycle, what generally happens throughout some of those negative behaviors being seen, and you know, when we're thinking about the course of what this substance abuser may have been through, that first negative behavior may have not been substance abuse, right? Withdrawn, risk-taking, attention-seeking, defensiveness. You know, we know that hurt kids act out, right? And so then we want to think about what kind of experience resulted from that. And very often consequences intended to kind of like extinguish the undesired behavior of a child, it often has a different effect, and it ends up actually pushing that person further into the abyss of confusion and suffering. And so this is kind of the cycle that we know substance abusers are stuck in. And so what are we going to do here to interrupt this? How do we pull them from it, and how do we help them learn to help themselves? So when we think about helping, you know, we're not saving and we're not rescuing. That is not what helping is about. Helping is a collaborative process of connection, support, and empowerment. It's the fundamental belief that all people are capable of change. How do we do it? Connection is extremely important. Connection should be understood within the context of our ability to form a mental and emotional bond. Connection is just a core basic need of all people. When we think about individuals struggling with substance abuse and mental health problems, there's severed connections of many kinds throughout their life. You know, if you spend time with someone in recovery and really explore what their healing process looked like and involved, connection, the theme of connection will always be apparent. And many would say it's our most critical avenue for healing to occur. One thing when we're talking about this endeavor of helping others, relatability. You know, it's just critical for helpers to be right sized. Please don't go out here impressed with your credentials, right? This isn't about your job title. This isn't about your status. This is about you being eye to eye with those in need. You know, authenticity, vulnerability, the appropriateness of transparency around everyday challenges and struggles. It's extremely powerful when helpers can normalize the human condition. I can tell you that you know, some of the most powerful words for a substance user or even someone with mental health struggles to hear is, yeah, me too, and you're not alone. And so as helpers, we want to make sure that we're really striving and exploring to find that basis for relatedness, because it's always there. Certainly there will be existing differences, but when you're thinking about that connection to someone that we know is so critical to achieve, it's just about us practicing some humility, embracing vulnerability. Can I be right sized? Can I show my vulnerabilities to somebody else if it's going to mean that helps me enhance that connection that I possess with that individual? You know, connection skills, active listening, empathetic responses, effective communication. You know, these are some of your basic counseling skills that must be practiced and on a regular basis and enhanced, hopefully. Critical task of helping others is creating a level of connection in which we're invited into that like private inner world of that individual. You can try to help a person on the surface all day long, but again, like we know this is about real and genuine connection to others. Support. You know, support, when we think about support, it's just about joining in the journey of another, being in touch with like our ability to provide presence throughout those struggles that most people generally feel alone in. You know, when we think about support, I would ask that all participants like really think about what support has meant to you and how you've benefited from another's presence throughout some of your greatest life challenges. Would you be where you are had it not been for others that really rolled their sleeves up and jumped into your life during some maybe stressful or challenging times? Think about where your life may be had those critical people been absent from your lived experience, right? Had you navigated some of those challenges alone? Perhaps you had caretakers who neglected or were so busy they ignored your needs and overlooked you. I mean, think about those ramifications of how real, just unwavering presence as we experience difficulties in life really makes a difference. There are a lot of different types of support. There's emotional support where we're providing love, support, reassurance, acceptance, encouragement. This one can be a challenge for helpers. Sometimes, we see helpers who are just extremely guarded. They show no emotion in that interaction with people they're trying to help. And that can be of consequence to the helping process. Informational support, providing guidance, education, and insight. This is where we're problem solving and brainstorming ideas for change strategies. Tangible support. Sometimes our preconceived notions and judgment, what's the old rule in the helping community? You don't ever give a substance abuser money. However, it's important for us not to be rigid. There's a young man that helps out at one of the local syringe exchanges on a regular basis, and he is just so critical to the success of this community event. And he will actually tell you that the turning point for him was that somebody gave him $7 to eat. And had they not done that, he would tell you he likely never would have been motivated to change. But it was that act of compassion and someone giving him something that he needed, despite the possibility that he may go buy drugs with that money. And so, just be mindful that, tangible support can be critical. Affirmational support, expressions of confidence, encouragement, strength-based interactions, conveying worth and belief in someone's ability to be successful. In working with substance abusers, most of them are used to being lectured. Most of them have heard what's wrong with them for many years throughout their life. No one's judging them as harshly as they do, and you ain't going to think no worse than they already are about themselves. And so, we want to make sure that in our interactions and trying to help these individuals overcome some of these problems, it's extremely critical to just have that confidence and support and be pointing out not so much what's wrong with that individual, but what's strong with that individual. And I think Mr. Jackson referenced empowerment, and this is one of the areas of evolving that this field has done, because for very long, when individuals were seeking help, it was kind of like the professional drove the car. We were going to tell you what your problem was. We were going to tell you what you need to work on, what it's got to look like. And if you didn't do it, we took our hands off you and sent you right back to where you came from. Thankfully, we now know that, it's important to allow individuals to self-determine. Process of helping others grows a lot stronger when we're allowing them to be in the driver's seat, steering the vehicle of change. It can be a scary ride. And as a helper, you're gonna be working with people and they're going to share some of their plans with you, and sometimes you got to get out of their way and let them learn hard lessons. But it's extremely important to let them really guide this process. Everybody's not going to work on the obvious, and so allowing them to kind of create this change plan. You offer support, you provide some feedback, guidance, but if you're in charge, nothing's really changing for this individual. We got to let them kind of establish the priorities and goals of their life versus lecturing them on what matters and what they must do. What we do generally see in individuals when they're kind of placed in that position of power in their change process, there is a strengthened commitment and increased involvement. And it's a beautiful thing to see somebody really take a proactive role. Very often in that empowerment process, it may be the first time that this individual has heard somebody say, well, what do you think and what matters to you? So empowering interactions look like listening without injecting our opinions, creating safe spaces for just unrelenting acceptance, regardless of what's going on. Substance abusers are always accepted, loved, just pulled into the crowd when they're doing well. However, when they start to struggle, a lot of times people just start backing up and taking their hands off of them. So very often we see in the times that they need us most, everybody's actually backing up instead of running to. And it's always a sad thing to see. We want to avoid criticism, shaming, and judgment. Establish genuine care and availability, regardless of where they're at. They will struggle. It is inevitable. There's no such thing as a straight line from from struggling and suffering to absolute progress and healthiness. It's an up and down ride, you know, and there's a lot of sharp curves that got to be navigated. You know, we want to validate their thoughts and feelings, utilize open-ended questions to help draw conclusions for their life. Strength-based perspectives remind people of their worth and abilities. We want to be referencing their ability to make choices, regardless of the circumstances. And you know, we always just want to help them brainstorm. You know, if you do this, what may be some of those potential ripple effects? But we got to help empower people and help them understand they have control in their life. You know, under the influence of drugs, their control is diminished and almost non-existent. But people have choices to make, and we need to respect those choices and make sure we're reminding them that no matter what's going on, there's always some choices to be made that can create a different life for you. You know, there was some reference this morning to resiliency, and we know that resiliency is about the strength to cope with stress and hardship. It's about our ability to withstand and work through adversity successfully. You know, strategies for building resilience, developing positive relationships, avoid awfulizing challenges, take decisive action, self-discovery, tending to needs, monitoring thoughts, develop and nurturing each, you know, the individual's strengths and abilities. You know, and I'm going to hurry up and wrap this up, but when we think about the healing process, you know, we looked at the cycle, the cycle of suffering that we know substance users are in. So when we talk about that healing process, we actually reverse that process. We want to start really trying to help them just, you know, focus on some positive behaviors, asking for help, opening up to others. You know, the list goes on and on and on about, you know, just some positive changes that can be made in the here and now. We know they're not going to feel better until some things start changing. And so as we help individuals really focus on just some small positive changes they could make, you know, there's improved stress responses, feelings such as hope, awe, inspiration, joy, all these things start returning. And for many of the substance users, they've not had these feeling experiences in a long time. As things kind of start to change, you know, we know our people begin to reevaluate their previously held ideas. We start challenging assumptions, picking apart our irrational and unhealthy beliefs. And as we go back through that process, those positive outcomes we have actually reinforce and just keep this cycle going where life continues to get better. And we know that people certainly can overcome substance use issues. Some of you may automatically be thinking, well, Chris, if it's that easy, you know, how come we're losing? How come, you know, we see high relapse rates and poor treatment outcomes? Well, we just need to be mindful. We're dealing with ingrained personality traits, developmental issues, you know, habitual thinking, feeling, and behavioral patterns. I'm sure Josh will talk about some of this, but, you know, when we think about neuroscience, the more often we think, feel, and behave in a certain way, it becomes physically wired into our brain. Neural pathways are like heavily traveled paths. Responses become automatic and really involve no conscious effort. Neuroplasticity, you know, no such thing as a fixed brain. We know that we, you know, can create some new neural pathways, but it requires a lot of effort, consistency, and time. However, we need to remember that the brain is naturally inclined to take the path of least resistance. So what's been dominant and done the most throughout the course of an individual's life along the lines of thought, feeling, and behavior, it's going to remain the most likely response. So we should not be shocked, upset when an individual regresses in some capacity in their process. You know, in fact, how could they not, right? And so we need to meet that with compassion and support and help them understand that just because you've taken some steps backwards, that doesn't mean we have to give up, and it doesn't mean that you're not committed to change. You know, a lot of the flaws in societal systems, family dynamics, you know, a lot of the things that have conditioned and produced what we're seeing in that individual, they still exist long after that person's trying to make changes. Unhealthy family dynamics, you know, we need to think about triggers are powerful and can come from a variety of places throughout a person's life. And again, you know, when we're thinking about neuroplasticity, that trigger can you know, produce something out of that individual. And where we may respond with, oh, they're not serious about changing, they're not committed, that's actually not true. So avoiding harm, it happens in the helping community. I can tell you, we often are working with tremendously difficult situations, dealing with extremely complicated issues. We're working closely with unique people. We need to have a broad skill set. You know, those few things at the bottom of this slide are more about the professionals on the scene trying to make a difference. Judgment, shaming, criticism happens all the time. Oversimplifying problems and solutions, you know, implicit bias, we all have it. Are we aware of it, and what are we doing about it? Competency deficits, you know, a lot of times you hear about, you know, AA and 12-step facilitation being referenced. Well, who's talking about smart recovery? You know, we've got various models to help people move through the system and overcome their problem. But how familiar are we with it? Are we educated enough to provide some guidance to that individual? Compassion fatigue, burnout, boundary issues, you know, these are all things that certainly can create serious consequences for those trying to make changes. You know, what we need to think about, I'll say this in closing. I was talking to this guy, we were at a training a couple weeks ago, and we were talking about some just connection and support skills and how do we do things differently. And this guy goes on to kind of rebut what we were presenting and says, well, this is how we do it here, and this is how it's got to be done, because you just don't understand these clients. They're argumentative, they'll challenge you, they'll check you. And so in his rebuttal to us, he said the most dangerous thing that a professional can ever think or say, and that's, but this is how we've always done it. So I gave him a few minutes to express himself, and then I followed up asking him, thank you for your contribution, sir, but could you tell me what your success rate is at the program you're referencing? And he said 20%, and I didn't have to say much else for it to kind of jump out to him what I was implying. And so then we were able to have some real meaningful dialogue. But you know, I'll tell you, thank you for your time today. I know I tried to fit a lot into this, but you know, I hope you understand that while we may not save someone from themselves, you can absolutely make the difference until they learn to become the difference in their own life. You know, this work isn't for the faint-hearted. The well-being of others is inevitably depending on us, working to become the best helpers we can possibly be. You know, when I think about that young man that I referenced in Shelby County being Gotham City with no Batman, you know, we know Batman's not coming and Superman isn't real. We can't wish, hope, and pray our way out of this. But please know the power of your presence in the life of another, you know, and that you certainly can absolutely be the hero this city needs or wherever you may live. Again, we can't save them, but we certainly can support them as they navigate this process of change, knowing that it includes and involves so much tremendous work and a lot of ups and downs in the process. So thank you for your time, and I am done, Mr. Austin.
Wow. Thank you so much, Chris. Am I on? Am I in here? Can anybody hear me? I can. You can? Okay. Thank you so much, Chris. I really appreciate that. There has been a lot of commentary on your presentation, and it really meant a lot to a lot of people. If you guys look in the chat, Chloe just posted the presentation and it says Chris Moore. Just look for Chloe Lancaster. It says Chris Moore. Please go there for your CEs. Chris, we've got time for about one question. So Destiny wants to know, what is the ultimate goal? To be free of drugs, or to be substance free of drugs, or manage their lives with substances? I think that's an interesting question.
It is, and I think it's you know, we're kind of at a crossroads in this field where we're really redefining what recovery means. For a long time, recovery was constructed and defined, and it was an individual's job who wanted changes in their life to conform to that existing model of what recovery was and what it had to look like for you to be considered in recovery. You know, Mr. Jackson referenced harm reduction. We know this field is changing. And so, you know, what you're seeing now is a real push to allow people to define recovery for themselves. you know, we have got to, if we truly want to help other people and try to really overcome this problem of drugs throughout society, we've got to build more inclusive communities, right? We've got to expand in our understanding. We've got to challenge the master narratives that have existed around this problem of drugs. You know, and so some would say that this is what recovery's got to be. But in harm reduction models, we would say, hey, if an individual can eliminate, you know, opiate use and maybe they perhaps drink on occasion, but they're able to kind of make some real progress in their life. Their relationships are improving. You know, across the board, they're making progress. What else would you call that but recovery? And so I think that thankfully, we're allowing individuals to define recovery for themselves. And again, we're empowering them with the right to self-determine and create the life that they want for themselves, not what we tell them it should be or what it's got to be of meaning and worth.
Sure. Sure. Well, thank you so much. Your presentation was incredible, and I'm honored to know you, and I know that everybody got a lot out of that.
Thank you so much.
So we're going to take a quick break, everybody, from 10:55 to 11:05. Like I said, the CEs were just posted in the link. It says https memphis.co1 is what it starts with. It's got Chris Moore